Development Governance International (DGI Consult) is a purpose-driven governance and institutional capacity strengthening consulting firm that is deeply committed to the belief that strong governance systems, innovation, effective leadership, and accountability are the keys to unlocking solutions for development challenges. These principles form the very core of our organization's philosophy. Guided by the power of evidence for decision-making, we understand that in the world of development, good intentions must be backed by data-driven strategies to make a real impact. In our 5 years of existence, DGI Consult has implemented important projects towards improving the country's healthcare system in the quest for universal health coverage. We achieved this through organizational capacity strengthening, health financing diagnostics, community health system strengthening, capacity building for health workers on facility and financial management, domestic resource mobilization, human resource for health optimization, startup support, and capacity strengthening of state social health insurance schemes. Our ability to deliver state-of-the-art technical assistance and program management is made possible by our experienced staff and vast network of local and international consultants. At DGI Consult, our goal is universal health coverage, and we find joy in hearing from project beneficiaries about their experiences.
Ba ni da lafiya, ana taimaka min, ana zuwa gida kuma ana sha min ruwa. Yawwa kuma ina jin daɗi. Gode, na gode.
Za a auna jininka, a san cewa duka za a ɗiba jininka a gwada, a san menene damuwan da ke damunka kafin a baka wannan magani. Kuma ba ko sisinka, ko kobo ba mu biya ba duk mutanen da muka yi amfani da wannan magani.
Before now, if I'm not feeling fine, I rather go to the public health center for a treatment which cost me from my pocket. But with this coming of health assistant, if I'm not feeling fine now, I go to the hospital and get a free treatment without a cost.
This carry was really helping my life because by the time I was not feeling fine, I carried my card. I went to PSG Open Pada Primary Health Care.
Allah ya kone daga jarabawa na zazzabi ke tsananin haƙori ya fara min ciwo. Da ya fara min ciwo sai baki fati na sai na tafi kilinin na. Ne musu bayani sai suka dan fara min taimako da ƙwayoyin magani da su allurai. Sai da dage na ji sauƙi sosai na ce kai. Mun gode ma Allah ga wani sauƙin da.
We take immense pride in the positive impact our projects have on healthcare systems, communities, and individuals. But don't just take our word for it. Listen to what some of our partners have to say about us.
DGI has distinguished themselves from what the partners work with issues around coming up with sustainable strategies around community health finance. And they've also distinguished themselves not only as a foundation, but also in terms of a consults that we have worked with, in terms of helping us identify what we really get to do as an organization in areas of health insurance. And we felt that we need to put our money where we have found the solution. So that's why we are working with DGI on this journey so far.
DGI have been with us from the start, up to this point. And their impact is synonymous to some of the achievements that we've had because they've provided a lot of technical support. They've had funding from LHSA, had funding from Christian Aid that has directly affected our operations, that has even directly affected our outlook in the state and even outside the state. We are believing that that will be replicated even across all the other sectors of Nassau in the health system.
When we advertised for local organizations, that is indigenous organization, emphasis on indigenous, to apply for grants way back in, I think, called maybe around maybe November, December 2022. We wanted an organization that is Nigerian, that is indigenous and very vast in terms of their experience in building the capacities of organizations. And so it was a fair process where we wanted other people to also compete as well. And we sent the request for proposal, the RFP, out to organizations including DGI and other organizations that we had come across, and then it was a competitive bidding process, reviewed their proposal, and DGI proposal stood out as the best among all the ones that we reviewed. And so and of course we went through the engagement process so that DGI became our grantee officially since maybe around February or thereabout. And so they've been part of the design from the start. And like with their experience working in other states, establishing, supporting similar insurance agencies and even healthcare development agencies and boards in other states, we knew that we could achieve a lot together. So they were part of they were also part of the design of the entire implementation plan for the grant. And then we had the idea for the grant, but by the time we engaged DGI, we developed an implementation plan together. And then they were the leading implementer in terms of the organizational capacity assessment.
The Deputy Secretary of Gombe State Contributory Healthcare Management Agency, and we just wrapped up a 4-day workshop facilitated by Development Governance International to build the capacity of the World Health Technical Team, as well as the Board of the Gombe State Contributory Healthcare Management Agency, in the implementation of contributory schemes towards the attainment of universal operation general. The journey towards the actualization of Go Health started sometimes in 2019 when the signing into law of the bill that established the Gombe State Contributory Healthcare Management Agency by His Excellency the Executive Governor of Gombe State, Alhaji Muhammad dated of December 2019. The Ministry of Health, in its own wisdom, established a 5-man technical working group to midwife the processes for the commencement of the scheme in Gombe State. And at the same time, the ministry also engaged the services of Development Governance International, DGI Consult, to work with the TWG to conduct the design, scheme itself. That 4-day workshop that was held in June last year was really an eye-opener. It really built our capacity. It really showed us, how to do this health insurance or contributory businesses, and it helped us to develop the basic tools, that we are going to be using in implementing the scheme. Because of the kind of knowledge and technical support we got from DGI, we deemed it fit and necessary to once again invite them, to work with us in this pre-implementation phase once again before we start providing the service, to validate the documents that we developed together with them, for 1 year ago to be precise. And this 4-day workshop has really been very, very successful and fruitful. Our knowledge base has improved, our capacity has been built, and we've been able to validate our operational guideline together with the board of the agency. I would like to use this opportunity to especially thank Dr. Gafar Anawudi, Dr. Charles Andumweze, and pharmacist Ayomide for their immense, support and contribution, in the establishment of the Gombe State Contributory Healthcare Scheme, otherwise called Go Health. We are really very, very appreciative, and the history of Go Health cannot be complete without a chapter being dedicated to DGI. That is the kind of support we got from them, and we promise to continue engaging with DGI, until we reach the promised land, inshallah.
My name is Suleiman Dauda, the Director of Program Yobe State Contributory Care Management Agency. I'm very delighted on behalf of Yobe State Contributory Care Management Agency for the profound technical excellence and insightful expertise as a result of our partnership with DGI Consult in the last 3 years. We have worked with DGI on various technical areas that have greatly transformed the agency's operation into a more data-driven and evidence-based contributory scheme in the state. Of course, together with DGI Consult, UHMA was able to develop some very important documents, such as client satisfaction survey that we conducted. We also did fiscal space analysis, outcome indicator survey, and other significant manuals and guidelines was developed as a result of this partnership. This has enabled the agency to understand and analyze various performance indicators and design a scheme. It has also optimized quality operations and guided the agency in generating insightful recommendations for thorough through a technical collaboration with DGI Consult. This valuable partnership with DGI Consult have not only elevated UHMA technically, but have also leave a lasting operational impact on the agency and our stakeholders.